Hey, I didn't make mine. I'll be honest, my team did. They're amazing.
It's a really great event. So the Silicon Valley Council of Nonprofits has their annual event tomorrow, but it's going to be Zoom. It'll be interesting to see how they do it.
Yeah, I know, it's kind of a bummer. It's so fun.
That is a fun event.
Yeah, it's a lot of fun.
All right, everyone. So we're gonna start just as quick as we can at 6:30. So we'll give everybody a chance to join in and let everybody get the Zoom bugs out, because I know there will be at least somebody who's got a Zoom bug. Leslie, thank you for being here to make sure we're all okay.
Of course, not a problem.
And just to confirm, we are now live on the web.
Thank you. Well, good evening, everyone. And I know we're going to have folks join, and I'll repeat myself a couple times just to make sure everybody's on the same page. But let me just talk about what our goal is tonight. We're going to do our roll call and approve I think I'm going to hold off approval of the consent calendar, and just because there aren't going to be changes to the agenda, because we're going to do at the end, we're going to have a second vote on the minutes. So we'll just do it then for the clerk so that you don't have to do that twice. Item 3 is we're going to consider recommendations relating to the unhoused population. But before that, and then as part of that, we're going to receive a report from the behavioral health and homeless team. We're going to receive a report relating to possible recommendations, and then discuss and hopefully approve some recommendations that we can forward to the board. We're going to take item 2 and 4 together, because that'll be approval of the consent calendar and then approval of a delegation of authority for me to look at our last set of minutes, and then we'll go to public comment. So with that, I'm going to ask if our clerk can call the roll.
Sure. Member Jordan.
Present.
Thank you. Member Haraz. Member Catherine Haraz. Council Member Bybee.
Present.
Thank you. Mayor Stephen Scharf.
Present.
Thank you. Council Member Bracco. Council Member Dion Bracco. Okay, absent. Mayor Pro Tem Martinez Beltran. Mayor Pro Tem Ivan Martinez Beltran. Okay, absent. Council Member Sinks.
Here.
Thank you. Council Member Dominguez. Council Member Karina Dominguez. Absent. Vice Mayor Nunez. Vice Mayor Bob Nunez. Absent. Mayor Lawler.
Present.
Thank you. Mayor Constantine. Mayor Rich Constantine. Absent. Council Member Ramirez.
Here.
Thank you. Council Member Perales.
Here.
Thank you. Council Member Esparza.
Here.
Thank you. Council Member O'Neill.
Here.
Thank you. Vice Mayor Smith. Vice Mayor Nancy Smith. Absent. Mayor Klein.
Here.
Thank you. Member Clark.
Here.
Thank you. Member Reeve.
Here.
Thank you. Member Itari.
Here.
Thank you. Member Baines. Member Kelsey Baines. Absent. Member Franklin. Member Brian Franklin. Absent. Member Sharp. Member Samina Sharp. Member Stepanov.
Here.
Thank you. Member Cooper. Member Crystal Cooper. Member Pham.
Here.
Thank you. Member King.
Here.
Thank you. Member Shaw.
Here.
Thank you. Council Member Niss. Council Member Liz Niss. Vice Chairperson Allenberg.
Here.
Thank you. And Chairperson Chavez.
Here.
We have a quorum. Is there anybody whose name I did not call or missed roll call?
Mayor Pro Tem Yvonne Martinez Beltran.
Thank you.
Thank you. Everybody else got called? All right.
Sorry, Kelsey Baines just joined.
Oh, thanks,
Thank you.
Kelsey. Thank you, thank you. All right. So, so first of all, let me just say a big thank you and apologize for having to cancel our last meeting. A number of us were called to a special meeting of the Bay Area regional governments, ironically, to talk about housing. And so if we had been here, we wouldn't have been able to do that. And so I apologize for that and really appreciate people making time again tonight to be with us. The a number of you, I know if you've looked at the agenda, what you're going to see is, and I'm just going to remind everyone that we have a number of reports that we're going to get. What I'd like to do is here items A, and this is to receive a report of, I think this was our behavioral or mental health topic, and then receive a presentation. Receive a report from the Office of Supportive Housing, and then receive a report relative to behavioral health, and then discuss possible recommendations. After we have that discussion, I'll go to public comment before we make any final determination, but I wanted the public to have the benefit of listening to all of the different presentations. So to get us started, and let me just say tonight, if there are questions that are, my big goal is really for us to dive into what we can recommend, and make sure that we have time for a robust discussion. So I'm going to ask people to make sure their questions are concise, and I'm also going to remind all of our presenters to present as crisply as you can. So on item 3, we're considering recommendations relating to the unhoused population within Santa Clara County, and that will begin with a presentation relating to behavioral health and homelessness, I think is the right way. I've got two different sets of notes here. So staff, am I right?
Yes, thank you.
Great.
Thank you, Supervisor Chavez. Hillary's going to pull up the presentation. And before we introduce the Behavioral Health Department, good evening, everybody. Consuelo Hernandez. I'm the Acting Director for the Office of Supportive Housing. And just wanted to share very quickly our organizational chart. For those of you that are unfamiliar with our office, this is based on budget units. So the Office of Supportive Housing, half of us operate under the County Executive's Office or under the CEO's department. You'll see the OSH Director reporting directly up to the County Chief Operating Officer. But then our operations team actually is housed in the Behavioral Health Department. So you'll see here the supportive SHS is the Supportive Housing Services Division, and that division is responsible for all of our permanent supportive housing programming and our outreach and engagement. And with that, I will pass it on to Margaret and Sue, who will give you a presentation about our Behavioral Health Services Department.
Good evening, everyone. Can you hear me?
Yes, thank you.
Okay, great. So I'm Margaret Obelaw. I am the Division Director for Adult and Older Adult Services. So as Consuelo had mentioned, we do have a few slides that we are going to be presenting. So this slide is a big overview, right? So a high-level overview of how individuals flow into the behavioral health system of care, especially on the adult side. So on my left-hand side, you do have the first section there that talks about one entry pathway into behavioral health, and that has to do with individuals reaching out through our 1-800 number, through our 1-800 number. We have individuals are able to walk into our outpatient clinic or also through our urgent care. The next part of it there, the second level of it, talks a little bit more of individuals who are in the institutions, for instance, if they're in jail, if they're in inpatient hospital, if they're in the IMDs, how those folks are able to access behavioral health services. And then on the way below, you have homeless engagement and access, as well as other areas of access into behavioral health. So you have through the mobile crisis response team, people can access through the crisis text line, through our law enforcement, our suicide and crisis hotline, through our primary care providers, and also the community. And then if you move towards the right-hand side, you see the coordination as well. So if individuals access our care through our call center or through any of those other institutions, then our call center is able to direct them into an appropriate level of care, right? So they're either going into a regular outpatient services or they're going into an intensive outpatient service that it could include any of those ones, either our assistive community treatment, intensive FSP services, or substance use, or whatever seems to be more appropriate at that time. We also have the urgent care as another access into our behavioral health services. So again, individuals can walk into their pod, get assessed for treatment, and then get assigned to an outpatient and access, which is offered through so the hub in terms of individuals who are coming from the community, who are unhoused and who are looking for behavioral health services can access either they get referred into the IHOP program or they get it referred into the homeless engagement and access services. And so this is a high level patient flow into behavioral health system. Next slide, please. So this next slide talks again about, it's a summary of the primary teams that are really involved and do a lot of partnership in order to support individuals who are unhoused. And so again, our mobile crisis response team is very critical in this, in the sense that they respond to community crisis or also they do crisis screening, they do de-escalation, they work very closely with our law enforcement liaison. Then we have the homeless engagement and access team, the HEAT team. This team is primarily located through our Office of Supportive Housing. And they also work very collaboratively with a mobile crisis. So they either sometimes call mobile crisis if they feel the individual requires de-escalation or crisis intervention, or we refer, so the mobile crisis team would refer to them if the individual isn't homeless or is in an encampment and the person needs coordination and provision of housing services. The same thing with the IHOT team. The IHOT team works very closely again with both the HEAT team and the mobile crisis. The IHOT is really our aftercare. So if an individual is seen by either the HEAT or mobile crisis team, and that person does not require further hospitalization, but require follow-up in terms of possibly assigning them to an outpatient services, the IHOT team would engage them, and they can work with them for up to 4 months to help, move the individual along to other services that may be appropriate. Finally, on this particular one, we talk about the Valley Homeless Healthcare Program. This is also works specifically with a homeless population, an individual not housed. They go to the encampments, similar to all the other 3 mentioned previously. They provide primary care services, as well as mental health services for individuals who are more mild to moderate. So they provide depression, anxiety, or individuals who have post-traumatic stress disorder. They assist those individuals to link them to services. If those individuals need ongoing or they're more severely mentally ill, then they get referred into the behavioral health system of care. Next slide, please. So I tried to provide a little bit of some of the bed capacity available within behavioral health for some of those programs for individuals who are unhoused, but may require additional support with their daily activities or require additional support with medication management, or also support with getting to various types of appointments. So we have transitional housing. We also have the adult residential program, which has capacity to serve up to 85 people. We have a crisis residential program, which, it's a 30-day length of stay and serves individuals coming out of emergency psych services, individuals coming out of inpatient hospitals that may require additional stabilization in a structured setting before they go out back into the community. And then, of course, individuals who may require residential care services. If they are unhoused and require permanent supportive housing, or they require shelter-related types of housing support, then those folks have worked through the HEAT team and also through our Office of Supportive Housing. And that's how they are able to access housing and other types of bed capacity that is available. Next slide, please. So this final slide just talks about a lot of the partnership or some of the programs that we at Behavioral Health and Office of Supportive Housing partner a lot in terms of serving individuals who are unhoused in Santa Clara County. And again, I've mentioned a few instances that we partner with Office of Supportive Housing, and Sue can go into that a little later. Criminal justice and through the custody health. So a lot of times if individuals are stepping out of jail or they were seen over in 8A, for instance, and they require behavioral health services, we work through either the Division of Justice involved folks, or they're referred down through the call center into any of our outpatient programs. We work very closely with the Public Guardian Office, especially for individuals who are conserved or on temporary conservatorship. And we also work a lot in terms of unhoused folks who may need to be conserved. With social services agencies, we actually have a staff person located over at Adult Protective Services, and we do a lot of collaboration, especially if there are individuals referred out into the community. If the individual is unhoused, we have our staff person work very closely with Office of Supportive Housing or with behavioral health to offer that individual, place some form of placement. Employment services, we also have 2 clinicians over there who work very closely with general assistants, because we've also found that sometimes individuals there may be homeless or they may need behavioral health services that may not necessarily access our through the call center. So those folks also get referrals through the employment services and also through GA, and that's how we help those individuals access services. And of course, through the jail diversion, and we work very, very closely with Valley Medical Center, the 2 new hospitals as well. We go out there as necessary to partner with them. We have staff who go out to assist with 5150s if necessary. If an individual comes into the hospital and they're homeless and they require either shelter or some form of housing, we also do a lot of that coordination with the various other departments to get those people housed. So that's my presentation for now, if there's any questions.
Thank you very much. And I'll see if there are any colleagues of mine who have any questions they'd like to ask. And I'll start with Councilmember Esparza, and then I'll go to Antonina and Dr. Pham.
Thank you. Thanks. That was really helpful. And I had pulled the items from strategy 3, number 3, about the increased mental health and substance abuse services under the community plan to end homelessness. And one of the items in there is essentially a gap analysis to eliminate service access and treatment gaps for unsheltered people struggling with chronic and severe mental illness. There's another item in here about behavioral health. And so I just wanted to ask, have we done that gaps analysis to identify treatment gaps for the unsheltered? In other words, what exists now and what the need is in the community?
Are you referring specifically to behavioral health?
Yes.
Okay. So do you want to?
Yeah, I could start. I could start with what we have now. So I think, currently through the supportive housing services, we are working with individuals who have been chronically homeless or homeless. We provide full array of services such as outpatient level of services, FSP type of services, which is really more intensive level of engaging with the clients. We use the model where the case managers and clinicians are working closely.
So can let me intervene for a minute. What Maya's asking is something very specific. The question is, have we done the gaps analysis that's identified in the plan relative to what the need still is among the homeless population?
If I can, no, we have not. It's a strategy in the plan.
No problem. We just wanted to yes or no on that. Great, thank you.
Okay.
And then when, I know this has not been a normal year by any means. So is it when do we expect to be able to get to that?
That's part of the implementation, Councilmember Esparza, that we are delayed when, so we are anticipating to bring that in the spring.
Okay, cool. Thank you. And then I had a question on On the flow, the adult and older adult patient flow side. So on the mobile crisis response unit, I was trying to understand the flow. How, I guess, oh, thank you for pulling it up. I was trying to understand the linkage between someone who's still on the street and is experiencing mental or behavioral health crisis and is ready to accept help. And I've used the example before of getting a detox bed, or maybe it's something else. I'm not a behavioral health specialist. And particularly with the mobile crisis response team, in the area that I've represented, we've tried a few different things, and we've experienced where the folks on the ground are very responsive, and the mobile crisis response team is very responsive, but they've had challenges on the back end getting the bed, getting placement, getting a placement essentially. And how exactly does that flow work in real life, or is there a place that it doesn't, and we kind of recognize that and we have to work on that specific linkage?
Yeah, and let me respond to that, because I think here's what my observation is, Maya, is that the point you raised earlier about how we do a proper assessment is really critical, because what we need to understand, I think, in our system is where we have a high need and we don't have available services. Because in some areas, I think we're actually almost caught up, and in some areas maybe even doing a little more services. So one of the benefits of the assessment is working with our partners, particularly our nonprofit partners, on figuring out how we can do a better job of restructuring the resources we currently have. And then the other thing that is really an ongoing challenge is working, depending on the community we're in, to find enough housing to be able to put program in so that we're able to provide more services. So I think that is a work in progress. More specifically, the question though, that if you're asking the specific question about the connection between mobile crisis and a person getting a bed, then I'll have the staff explain that process to you.
Okay, great, thank you.
So can you explain that? Or Margaret?
So I can explain that. So mobile crisis, usually it's either through a call that is coming from the community, or somebody else in the community sees this individual who needs help. Mobile crisis connects individuals either to the IHOT or to the homeless engagement and access team. And so those teams are the ones who now work to try and house the individual. And they're able to carry on with that individual for a couple of months. So they are the ones who work on looking for the shelter beds, looking for what will be their most appropriate place for the individual to be placed at that particular time. I don't know if that answers your question.
Yeah, I think it's helpful. I think there just are a lot of moving parts to this, and I fully appreciate that. And I just, it helps me to understand this, and I look forward to the gap assessment study. And then I think whether it's shelter, transitional, or permanent supportive housing, I think behavioral health is really a key component, and it benefits all of us to really, because that's how folks can come in and stay in, is if we can provide that service. And so I just think it's critical. So thank you. That's it. Thanks.
You bet. And I'm gonna just I'm gonna say to the staff, if you're not sure about the question, let's just ask it again so we can, because folks are learning and we want to get them as much information as possible. Great, thank you. Next, I think it was Antonina.
Yes, thank you, Supervisor Chavez. I'm glad you have this flow up. One question I have, and you may have already answered it, is that when the community sees a crisis, there must be a number that the community can call in order to help out get assistance for this person. Is that correct?
Yes, there is a 1-800 number the community can call.
Can you tell us what that 1-800 number is, please?
It's 1-800-704-0900.
Thank you so much. That was my question.
And the community can pick option 2, because option 2 goes directly into to the mobile crisis triage team.
Great, thank you.
Thank you.
Thanks, Margaret. I forgot who was third. Let me look at my list. Ah, Dr. Pham. Thank you.
Thank you, Supervisor Chavez. I have 2 questions, and I like to get the answer for the first one first before I ask the second one. My first question is regarding the contact between the employment service and identifying the client and refer the client for services. How is that link? How could the employment service being able to identify these individuals who have issues with employment and refer them?
So we have 2 clinical staff as a result of the whole person care that are actually located at employment services. And so when employment services meets with individuals and they do an assessment and determine there's some mental health related issues going on with the individual, they refer that person on to one of our clinicians who follows up with an assessment. And that's how that connection is made.
So this comes to my second question is that the person is being evaluated by the employment service. So is that part of an effort to try to find jobs for these individuals? Or is there a program to try to retrain them, finding them jobs, and try to send them back out to the community with a job? Is that part of the effort?
Not on our end. That's the part of the effort on employment services end. On our end, it's more to link them with behavioral health services if that's going to help them in terms of maintaining their employment or as the search for employment. Because some folks may have a lot of depression going on because they can't seem to find a job. And so we can assist the individual manage that depression, link them to ongoing behavioral health services as they work with employment services to continue to look for job or retraining or whatever else is going on that end.
So may I ask one more question? How did they get to the employment service? How did they get into that those programs that the employment service able to identify them and help them?
Margaret, maybe if I can chime in here, I think he's referring to the unhoused individual. Okay. So part of the service package or the assessment of the individuals includes employment connection. So depending on whether they're ready for employment, those services are connected when we provide permanent supportive housing. So Margaret's referring to people in general that receive behavioral health services, but if they're unhoused, newly housed, they're connected with medical, health, employment if they're ready for employment, and anything else that they need in order to stay housed.
Thank you.
Mm-hmm. Yvonne?
Thank you, President Chavez. First, I want to thank Councilmember Esparza for your question because that was also one of mine, and I suspect many others are looking forward to that gap analysis. But I'm really curious to try and understand how we deal with severe mental illness that's chronic, that cannot people who cannot live independently. One, how are they identified, and what part, I guess, of behavioral health or stage identifies those individuals that need the help?
So do you want to start with how they come in through housing support, and then I can follow up if they need. So they may come in through housing support, right? And if they are severely mentally ill, then Sue's team will continue to work with the individual to provide that mental health services.
I mean, I could, Margaret, maybe I could talk a little bit about engaging with homeless individuals who are severely mentally ill, and then how we connect them to the behavioral health services. That might help. Yeah. So let's say we find an individual who's on the street, and that person looks very severely mentally ill. That's when our HEAT team will go out and try to engage with them. There are many cases where, because of their mental illness, paranoia, and things like that, they actually will have nothing to do with the clinical team, right? And so they are working closely with the housing outreach team, homeless outreach team, who are very experts in working with homeless population, along with the clinical team. So we have 2 clinical social workers working with them directly. So they'll go out with them to continue.
Can I just ask you, are those 2 part of the HEAT team?
Correct. Yes, they are. So okay. They are, and so they are literally on the ground every day. When we will receive a call or email from the community members to various different interested parties about concerned person, then we will immediately go out, locate them, try to provide basic things like water, to try to engage with them. One of the things that we found over the years is that unless we continue to engage with them over long periods, it was very difficult to actually get them connected. So that was part of the reason why we have this clinical team where they'll actually go out months at a time if needed, work with them, talk to them, provide whatever basic needs they may need, socks and jackets sometimes during the winter times. And once they become more comfortable, then they will continue to using their clinical skills, provide motivational interviewing, and really ask basic stuff like, do you want to be in a shelter? Do you want to be referred to a program? And they will work with them. And so in that process, they will actually connect them to outpatient program or FSP. And if they are deemed really unable to live independently, that we will be working with Margaret's team. They have various different programs like RCF, residential crisis facilities, where people are able to receive care, medication management, and also food services on site, right? And so that's when I'll be contacting Margaret and her team to figure out the level of care this individual may need, what's most appropriate. We do have had some successes where they are placed in independent care or independent home in their own apartment, but also have live-in care. We would have in-home healthcare person to actually, because oftentimes we do want to place them and live as independently as possible, because that's what mostly they desire to do. So we want to support that. But if that is not possible, then we will work with Margaret's team and get them into higher level care.
Okay, and so higher level care, that would be, I mean, I hate to refer to a mental institution, but a higher level care would be.
It would be, so on that slide, I think there's a slide there where I listed some of those types of beds that we would put somebody like who Sue is referencing there. So it's on the next slide, not this slide, where it breaks out crisis residential, transitional housing. Yes. So these are all residential services that are not locked, right? Only if the person cannot maintain in any of these settings would we now discuss putting them in a locked setting, which would be like a Institute of Mental Disease or a mental health rehabilitation center. But those, in order for us to put an individual there, that person needs to be conserved.
Okay. And do we have any type of how much capacity we have for those types of institutions? And I don't want to take more time, President Chavez, but the line of my questioning is really, I'm just going to, have had.
Yvonne, are you asking about locked facilities?
Yes.
So we have in the county approximately 150 locked facilities. Most of them are at capacity, and there's a really good report, and that I'll ask staff to send out to the group that has a much better. It's kind of a broader set of numbers that look at the whole continuum of care, because some of what we're talking about for the purposes of this committee is really focused on the homeless community, but there's a relatively large continuum of care that is part of the adult and system. So we'll be happy to connect you to that information.
Okay. I don't want to be out of scope. I just, I have heard from some of our law enforcement that some of the individuals that continue to experience homelessness, they just feel they've had, up to 100 incidents with them and feel that they need to be in permanent facilities, and that it's almost criminal for us to continue to leave them on the street. And so that's really
and to be blunt, what I would say is that part of the discussion we're having right now, and part of the reason we're doing an assessment, and it's not just for the homeless community, but continuing to reevaluate our needs, is really being as disciplined as we can with limited resources on how we create the appropriate options for placement. And actually on another committee that I'm on, we were diving into that just yesterday. So you're asking the right question. It's just that we're in the process of figuring that out. And I know the cities feel very limited in their resources, and believe it or not, we do too, in terms of where do we invest on what part of the continuum.
Okay. Thank you.
Yeah, thanks a bunch. All right, Lisa?
Hi, yeah, I'm here. Can you hear me?
Yes.
Okay, good. I know I've heard a lot of complaints through other people about the Mobile Crisis Center, and I wanted to know if there's any criteria that makes them go out or makes them not go out to a call.
Good question. Margaret, do you or?
Yes, I mean, I can answer that. We do have some criterias that would make them not go out on a call. And some of it is because we are now getting increased number of calls. And so we are triaging the calls, right? And sometimes we are also looking at what's going on for that individual. So there are some criteria. So if there isn't a full-blown behavioral health crisis going on, we may determine that it's not us who needs to come out, but maybe the police that needs to come into that picture, or maybe that particular issue that is going on need to be dealt with in a different kind of way. So I know staff have brought up some of those issues as they have come up. It's not.
Who makes that judgment call?
So there is a senior manager who is triaging and also consulting. The staff consult with a clinical licensed staff who is also helping to filter how the calls come in and which calls people should respond to.
And Lisa, this is Cindy, just to be kind of blunt about it. I think with mobile crisis, we have 8 mobile crisis team members now. The city of San Jose added another 2 officers and a clinician in partnership with us at the county. And we also have, as you know, probably know, is that we have youth mobile crisis too. And one thing I would say is that we're still really learning this system. And I feel like we're going to get better at determining the appropriate response and who responds and the appropriate level of response. And one part of the more advanced program, and something I'm really excited about with the city of San Jose, is that the city of San Jose is going to be using downtime to visit people who are frequently 911 is frequently being called on them, or that their family members are calling, so that they can start to do more prevention and more intervention and wait less for someone to be in total crisis. But that's something I think we're still kind of getting our arms around.
Okay, that's good that we're definitely working on it, because I know there's a lot of people out there that I just see through my work, and who really need some sort of psychiatric care and some long-term psychiatric care and handling. I know now, we don't like to lock people up in institutions and like to give them the benefit of the doubt, but I know that there's several people out there that their mental illness is so bad that they're really not taking care of themselves. And sometimes I wonder if we're not doing a detriment to them by leaving them out there. I also wanted to know, what I count here is like 376 mental health beds. I know it's difficult to find a bed, I've done it with friends for rehabs, and I've tried to help other people with finding some sort of mental health care, and that 376 beds covers the whole county.
Margaret?
It does cover the whole county because they have various lengths of stay. So for instance, the transitional housing is a 3 months or 90 days program. The crisis residential is a 30 days program.
Okay.
Yeah, and we also have, so the ones I mentioned here are strictly for the adult and older adult. We do have some other housing programs also associated with the justice involved programs as well.
And
Okay.
and this isn't, this is actually in part explaining why we're having this meeting too, right?
Yeah, that's exactly what I was just going to say, Cindy, that, I really see a need for us to up these mental health beds. But that's all I had. Thank you.
Thank you.
And I'm going to go to Anthony.
Hello. Margaret, what is the turnaround time from a person who calls the 800 number to the actual members of your team getting to that location? Secondly, does your team work after hours, like after 6 and the wee hours of the morning? And is there a DV component with your team members? I mean, is there someone there with trauma-informed care on domestic violence and situations like that?
So you bring up some good points. First, to answer your first question, we do have a 20 to 25 minutes turnaround time. A mobile crisis team really responds very quickly, and they do that response in a very quick and timely manner. In terms of someone who has trauma-informed experience, yes, all of our staff are trained on how to manage issues regarding trauma and all of that. What we are just in the process of establishing and developing is the DV aspect of things. So our Mental Health Services Act is going to be funding some amount of services for intimate partner violence and DV. And so we are looking at that very closely in terms of how do we roll that out on the county level, and who's going to get trained. And so we are now partnering very closely with probation because they have some programs already set up, and we're looking at that.
Thank you. Teresa O'Neill?
I think Anthony's trying to
point
something. Yeah.
Anthony, go ahead. You're on mute still.
I'm sorry. You didn't answer the question about after hours.
Oh, the hours of the service.
Yes, so we do have staff after hours. We also have added on-call staff as well to ask to respond during the wee hours of the night. So we have staff all through 24/7 now responding. Yes.
Thank you. Maya, thanks for catching that. I forgot on who I just called.
I think it's me,
Teresa,
Trace.
Yeah,
Thank you,
thanks.
Cindy. So my question kind of fits in with some of the other questions, including what Councilmember Esparza was talking about with it. I'm not sure this fits in with the gap analysis. So as we look at these numbers, will part of the gap analysis be to figure out, or is there a way of knowing what are the right numbers for these categories? You know, how many residential care facility beds do we need? How many crisis residential? Because, you know, I mean, I've known people and I've talked to families and I'm getting inquiries, like I'm dealing with some stuff even today from residents, you know, and the issue keeps coming up a lot of times. I can't get my loved one or whatever into a bed, or, you know, I have friends who have siblings that are on the street and they said, I just can't get them in someplace. So do we have a sense yet, or will that come through the gap analysis? What, you know, if these numbers aren't the, you know, I don't know, maybe they are, but if they're not the right numbers, what the right numbers are going to, or what we need to be shooting towards?
Yeah, so two things, Teresa, that I would just add. One is that this gap analysis is part of that assessment. The other thing that the board, I think this was a while ago, the board gave direction on was getting and I'm hoping with Sherry now in her seat that this will happen sooner rather than later, is taking all of the beds that we have countywide for all the different services, drug and alcohol, detox, there are other kinds of beds, and being able to look at how many people can use them a year and what the waiting line is. So that we've taken the first snap at that, which to me was still not detailed enough. So the staff will be coming back with another one of those. My hope is that that will align with the gap analysis so that we can look at all that together early in the next year to mid-spring.
Okay, thank you very much.
Yeah. Jerome? You're on mute.
So I had a question about when people leave the EPS, especially like individuals that are in encampments around the streets and stuff, how do you continue to keep track of those people once they've left EPS, since they're not in like a permanent location? And then also with the homeless engagement team, are the homeless engagement teams the individuals that decide if people are going to go to shelters or not? And if so, how does the county know whether shelter providers have adequate staff to help individuals that are in like a mental health crisis?
Mm-hmm. Good questions.
And also, I'm sorry, I apologize, Madam Chair. So I had my hand raised before we actually started this whole presentation because I wanted to ask about whether we could have public comment earlier, because I know there's a lot of public comment that doesn't exactly have to do with what we're going over right now, but I didn't get to ask that question.
Oh, sorry.
Sorry, because I have my hand raised, but then I didn't want to interrupt.
Yeah, I apologize. I didn't see it. Thank you, Jerome. And let me just say the reason the public comment is at the end is that one, we're taking it in the middle of this discussion, so we have something for people to speak to, and then at the end, again, it was a really, frankly, a choice I made so that I would have enough time to hear from all of you. But can someone answer the other questions that were asked by Jerome?
Yeah, I'll talk about the shelter first. So when the HEAT team actually goes out to engage with individuals on the street, oftentimes that's one of the first things they'll offer. You know, are you willing to stay at a shelter? You know, stay somewhere inside. And so if they're willing, then immediately they will contact one of the managers in the Office of Supportive Housing who manages all the shelter capacity. So we have various different beds in various different locations in the county. and see where it's available. We work with the individual to see if he or she is willing to go to that place, and they will do the immediate referral. So there are times when we would have to wait a day or two, but really often within a couple of days, they are able to get in.
All right, so do these individuals, when they're asked whether they want to go to a shelter or not, have they gone through like a psychological evaluation by like a psychiatrist, or is it just individuals who are out on the street doing outreach asking whether they want to go to a shelter or not?
So they have not gone through the evaluation through the psychiatrist, but these are the clinicians who are working with these individuals and really doing immediate. I mean, if they are in crisis, then they would obviously refer them either to EPS or contact the mobile crisis. They'll work in conjunction with a team to provide their address their mental health needs. And once that is stabilized, then so there has been many cases where they'll actually go to EPS, and the HEAT team will actually meet them when they're being released and take them to the shelter.
The second question Jerome asked earlier was, when someone leaves EPS, how are we following them? How do we continue to support them? What's our relationship to them? Is that right, Jerome?
Yeah, and so we also have the IHOT team, that the individual is linked to the IHOT team rather than just be discharged back into the street.
Mm-hmm.
Or we have a team that meets every day with EPS.
Mm-hmm.
And excuse me, the team, after the doctor assesses the individuals and feel that this person does not need further stabilization, they are handed over really to the group of 5 staff who are meeting daily to discuss discharge into the community. So they could be either sent to the shelter, and a referral is done right from EPS before the person discharges. If they're going to the shelter or they're going to crisis, we have the crisis person come out there and do the assessment as well. Or if they need to go into intensive inpatient services, we also have a staff person who's linking them. So we have someone from 24-hour care who is a licensed clinician. She's got her list and her tracking sheet, and every week she provides me information of individuals who've been linked and those who have not been linked, and we're going back and following up to make sure they're linked.
And HEAT team is part of that call as well. So they're all connected.
Jerome, did that answer your questions?
Yeah, I guess more or less. It just seems like if all the shelter beds are already at, I mean, not shelter beds, but mental health beds are already at capacity, because those beds are the available beds, not for just homeless people, it's for every member of the county of Santa Clara, or every person in the county of Santa Clara. That's the only amount of mental health beds that we have available.
Actually, these are set aside beds for the individuals that we have. So there are emergency shelters, but these are actually not emergency shelters.
Right, but Stu, let me just say this: we don't have enough beds. Like that's my belief. So I think by looking at this, and you're totally right. We don't have enough beds, and again, part of the reason we're doing this body of work is we've got to find places for people, and what's not part of this necessarily body of work is we have another group of people that have been working on behavioral health placement. It's another committee that's been working on behavioral health placement. And that's when I talked earlier about us being able to look at what the waiting lists are, that's what we're looking at to figure out what we need to add on and where we need to add on. But you're totally right.
Yes,
all right, thank you.
You bet. All right, we have 2 more speakers, and then I'm going to ask if we could move on, because I really do want to get to the kind of the other part of the meeting. So Kelsey and then Lee will have the last word.
Thank you. So one kind of comment about the questions that I've heard thus far, and this is coming from a place of, I'm a psychologist. I worked with unhoused people, formerly unhoused people for several years. And I have worked kind of across the continuum of care. And one thing I think is important for people to realize is that when you're seeing people on the street, when law enforcement are interacting with people, they're in an active crisis. It's not necessarily indicative of them needing to be permanently institutionalized if they appear to be out of their mind or acting in ways that are scary. So I think that's something that is important to keep in mind, is that when you change the person's environment, when they get housed, when they have the services they need, a lot of times their ability to maintain an independent life is greatly improved just by changing the environment. So my main question was about, a lot of my questions have already been answered in terms of the residential capacity issue, just because outpatient treatment is hard to do when you're unhoused. So my question was about kind of when people are coming out of the residential programs, what percentage of people are discharging into permanent housing, or into like kind of a not a state of crisis when they are leaving residential?
Margaret, I'm not sure if that's you or Sue.
Yeah, because yeah, Sue, do you have a sense of what percentage are going into permanent supportive housing?
I mean, I think I'm working more from the homeless population, placing them into permanent housing. So our primary work is really placing all of our clients who are chronically homeless into permanent housing.
Right, but
they may not.
Do we know what the answer to that question
Right,
is?
right. So no, I actually don't, because
Okay.
we place very small percentage into RCFs.
Okay, thank you. Kelsey, was that your only question?
Yeah, and I do think that's really important, because otherwise you have just cycling through doing residential over and over and over again. So getting people placed into permanent housing is important.
That's why we're trying to build it as fast as we can. You're right. Lee?
Thank you. My question is on the Reentry Resource Center is they have some great services, but a lot of the homeless are not allowed those services. You have to be on probation or parole. Can somebody tell me why that is?
I can answer that question. I think I may be the only one who can, unless Margaret wants to. But I would say that the main reason is that the way we initially funded that was, and the reentry program was actually established to support people who were coming out of custody. That was the point of it. I think what we've started to understand, Lee, is that really we need something more akin to a no entry center, so that people don't have to be criminally involved to get supportive services in a more open way, an easier to access way. And so that's something that we're trying to get the reentry center to eventually become a no entry center, so that people will have access to programs that are there. But right now our funding is really focused on people who are, we get state funding to focus on a subset of people who are coming out of jail and or prison.
All right, thank you.
Well, I want to say thank you very much to Margaret and Sue for taking the time to be with us tonight. And this is you all are the hot topic always, so I appreciate you being willing to get more feedback, and we really appreciate your time. So thank you. And this is from the group. Thank you.
Thank you. Thank you for having us.
So we're going to move on to the next item, which is to receive a report relating to the possible recommendations. And I'm going to have staff go through them. And then while staff is, and will this be, let me ask, is this Consuelo, is this going to be you?
Yes, Supervisor Chavez.
Thank you. One thing I wanted to just say before I have Consuelo take it away is that one of the outcomes of this is that there were so many people who applied to be on this committee. Like, honestly, it was 3 times what we could have had on it, and still we had the committee big. We would have had 100 people on it. So what we offered to do was, for all the people who weren't on the committee, we did a special meeting for them, and we shared with them some of the information that you got. And one of the people who was on that committee was, or who came and participated was actually a colleague of yours, Yvonne, and that was John McKay. And at the end of this presentation, I want to tell you what he shared with us and get your thoughts on his big idea. All right, Consuelo, take it away. A little drum roll.
Thank you, Supervisor Chavez. And we'll make it quick since I know we want to kind of get to the discussion part of this. For framing purposes, we just wanted to connect this all back to the community plan to end homelessness. Hillary shared this with you all at the beginning of these presentations. And here we've just boxed in the goal that we have of doubling the number of temporary housing and shelter capacity in the next 5 years. Again, a refresher, these are the high-level strategies around Strategy 3 to improve the quality of life of folks. I won't go through them again here. They are in your packet. But again, the idea is that the solutions that we've come to present to you all tonight all relate back to this Strategy 3. And what we provided in your packet, and what we also need to do, Hillary, and maybe we can send this through Nancy or the clerk of the board, is the Excel version. And what we wanted to provide you all with is this very simple tool that helps you assess and determine how to prioritize the different recommendations that are within the interim housing solutions. So the Excel file that we will send to you allows you to prioritize based on time, resources, and the type of setting, so that it's a little bit more interactive. And what we did is we took the matrix that provided you with the interim housing solutions and the related costs and considerations for you and turned it into a more simplified tool. And that's in your packet. We will send out the Excel file. Next slide, Hillary. And now on to the draft recommendations. So the first recommendation we think is something we've already been working with local staff, and that's to have all the cities within the county endorse the community plan to end homelessness by the end of January 2021. And really the ask for the elected officials on this Unhoused task force is to prioritize the scheduling of that recommendation. And what we've provided is an example of a staff report and the resolution that you can use. Our staff is on deck to come and make the presentation, work with your team to develop the tools, the staff report, or the resolution. The second recommendation is, as somebody noted earlier, there are a number of strategies and sub-strategies within each recommendation that warrants an implementation plan. So one thing that we are asking cities, all the cities and the county to do is to develop implementation guides that address homelessness consistent with Strategy 3. So one of the items we also provided in your packet is a chart that shows all of the different ideas and guides and strategies within each of the 5 sections within Strategy 3, and then an area for you to document how you propose to address that in your local jurisdiction. So the county will be preparing that and bringing that to the Board of Supervisors in the spring. The next one is to have all cities and county identify financial resources. I know a lot of you that we're working with right now have identified funding already, and we want to continue that partnership, but it's really thinking about, is there an opportunity to further leverage any resources that you have? And then the second is to prioritize land that is available for use as interim housing. And one example is in the city of Palo Alto, as we heard a couple of meetings ago, is using a site that is underutilized for the city and using it as a safe park program. So some of those ideas of parcels in your community that we can use for, collectively use for interim housing. And then within that is regulatory changes that reduce barriers to creating these programs. And what we did is we provided you with 2 examples in your packet. One is from the city of Mountain View and an ordinance that they adopted for their Safe Park program. And the other is from the city of San Jose related to their interim or bridge housing communities ordinance that they adopted. Again, to provide you all with best practices. And as you individually start to think about what are the solutions that your community, your respective community is open to taking, that you use these tools in your analysis. And Hillary walked you all through the work plan and walked you through the interim housing solutions. So what we've done is categorize them here. In your packet are the individual details for each program, how much money it would take in order to start that up, what are the ongoing costs. And the idea is that we as a county want to provide you with the resources that you need to help make and inform your decisions, your analysis, and then look to the county for any other additional expertise, any additional information that we can share with you, contracts, partnerships, link you up with service providers. So really, these are the recommendations for interim housing that you all have talked about in previous meetings that can form the basis of your recommendations generally, and then each city would respectfully decide, analyze what makes most sense in your community. And we'll leave it there, Supervisor Chavez, and happy to answer any questions.
Great. I'm going to have you go back to the previous slide, and let's leave this slide up since this is really our focus. And what I'm going to do is, if there's anybody from the public who would like to speak on this item, this would be the time to raise your hand. So if we have folks who want to speak on and give feedback to the draft recommendations, this would be the time. Let me just say what I want to share with you that John McKay, I thought the group made some really, really good points, and they weren't able to get as deep in as all of you are on and were on all the information about what the county and the cities are doing. But what John's point was I thought was really interesting, and I'm going to focus it on item 4. And essentially what he made a point about, well, actually it was on all the points, was that really we need to make sure that cities have every tool and that we should be building in maximum flexibility. And initially we wanted to try to get everybody to say, hey, like, what are the top 3 of these we should be looking at, or what should we not be looking at? But I actually think John's really right that every city is going to need to make decisions for themselves, and having the recommendations were actually recrafted after we had that meeting with all these folks, because a lot of their reflections were on giving flexibility and then prioritizing the community plan, because part of the plan that I think is actually impressive is that it's really ambitious but very doable. And anyway, so that's I wanted to share that with everybody as we go to the public speakers, that was my big aha from our meeting. So if we could allow folks to weigh in, would be great. If the clerk wants to call the speakers.
Yes.
Thank you.
Let's see. Our first speaker is B. Beekman. I am unmuting you. Please accept the unmute. And you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. I wish I wasn't first. I'm not that knowledgeable about these things. It would have been nice to hear other people. But I guess we'll start with a rookie and get into the deeper waters with further public comment. For this item, I need to look over exactly what are your recommendations more. I don't quite know them yet, but I've attended all your meetings and I'm eager to read it and learn about it. I've been just amazed at what I can give you a few facts of where I've been thinking and working myself at this time. I've been amazed by the work of the cities of Fremont and Redwood City. They're both working really hard, specifically on ideas of new housing that relate to ideas of equity and relate to the ideas of community and policing. They're thinking how those ideas can work together well. And I know that would be of interest to, say, Supervisor Ellenberg of Santa Clara County, who, with her community policing ideas, how can housing relate to the future? How can that build our better communities and with less policing? Thank you in your earlier words about your mental health unit and the work that you're doing with them. I've always been impressed when I've heard your mental health advocacy people, or not just advocacy, but the people who actually go out in the field They seem of interest to me. They seem like they can do really good work. Good luck in those efforts. And the MTC, that's my final thought. We're at a time to think of programs like BAFA, I think it's called. That's kind of a new experimental program. How can we talk about mixed income, very low income, and extremely low income through the BAFA program? And how can they learn to facilitate money and programs at the state level to better fit into local programs? How can we coordinate that better? Thank you.
Our next speaker is Leanna Crabtree. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Initially, I have a question, and that is this the one time for public comment, or are you opening it for public comment at another point?
At the end of the meeting, we'll have one more time for public comment.
Thank you. So regarding the presentations for the mental health support and the counting of beds, I have no dispute with any of that. I recognize that all of that is very important, and I recognize that your report is very important because you are addressing humanitarian relief. But I don't feel that the report, this is the report or the plan to end homelessness, is named accurately, because I don't actually see any addressing of a real root cause. You know, all of the people, no matter what their mental or physical condition is, when they're on the street, the fundamental problem that they all share is that they do not have enough wealth or income to pay for the available housing. And what I don't see is a real deep dive into, well, how many housing units, how many homes do we have in Santa Clara County? And of those homes, how many are occupied with long-term residents? And what's going on with those residences that are vacant or are being used for short stay rental? And why is there this gap that we have now approaching 10,000 people in our county that don't have enough income to pay for housing? And I would really like to see cities step up and preserve housing for housing use and not just as an investment instrument. And I hope that you will consider that in your local communities when you take this back, is what can you do to preserve housing for housing? Thank you.
Our next speaker is Shirley Stagger. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good evening. I'm with Affordable Housing, but lately my heart's really going out to those that are currently staying at the Motel 6 program that were taken off the street. Thank you. I've been listening to them. They're experiencing a lot of anxiety with the room key program ending, that they're not going to be able to get into another roof over their head prior to it ending. So my question is, what is the plan? Because if this other Motel 6 or these room key things are going to be ending shortly, what is the plan to ensure that they're not back on the streets and they get into housing? Another question too is, I know a lot of people that aren't able to pay their rent, and they do have a moratorium, but there's going to be a point where they need to pay that rent back. And I don't know how they're going to do it when they're then paying the high rents and owing all that back rent. So that's probably going to increase our homelessness by thousands. And what is the plan to address that? Just a little side note, I have a firsthand experience of some of the food that's delivered to the Motel 6 that is actually delivered to them where the dates are expired and it smells rotten. They throw it in the garbage. One of the people I know that I take home cooked meals to on Sundays gave me one of hers and I threw it in the trash. So I know that's another topic, but that's where my passion is. And I thank you for all you do. And if you could answer those questions. Thank you.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Good evening, everyone. Scott Largent. I would like to, the item I'm discussing is the behavioral health one, but I believe it's A, B, C, D on this item, so I don't think I'm off topic. I need to start seeing this stuff rolling out. I look at the presentation, I look at the nice graphs, I see all the recommendations, and it's just a lot of talk all the time. On a street level, I'm just not seeing it. The 376 beds, that was the same amount of beds 5 years ago when I threw in the towel and decided to stop using drugs. 5 years later, it's the same amount. And the behavioral health gal that got on here, you know, I have done my own audit of behavioral health. I was so frustrated with these services not rolling out that I figured, what the hell, go to every single one of their meetings, dig into everything and figure it out. I don't think they're being truthful with the board. You know, there's 10 outreach workers. I've seen one of them, an old timer downtown with a clipboard. I've seen him once. Okay, 25-minute turnaround. I've made a lot of calls where the turnaround didn't even happen. Some of them took 7 hours to coordinate with law enforcement for a woman that was naked across from City Hall, covered in her own poop. I was amazed that they had to try to coordinate and they couldn't pull this stuff off. And this 24 hours of working and having people on a call center later at night, I've experienced where 5 o'clock hits and these outreach workers, they jump ship. They go home and eat. They left a mentally ill meth addict that was homeless on top of City Hall. Okay, I spent the night up there with that man. Behavioral health bailed out. Okay, I just don't buy this stuff. We 376 beds. We need 3,766 beds. Thank you.
Thank you for all the public speakers. And I'm going to go ahead and go to all of you, and I'm going to ask if the staff could leave up the recommendations. I want to both be able to see you, but I also want to make sure folks have those recommendations in front of them. So I'll go to Antonina first.
I wanted to ask, it was actually something that the speaker Stanger mentioned, is that the number of people that might lose their housing, and there was an article in the paper, and I know that we had one of the things in there is the homeless prevention program that the county has, and it's not on here, and I'm wondering, I believe that should be on there, especially to beef up the budget on that. That's all I wanted to say.
Thank you. Thank you. And I'm going to go ahead and go to Raul.
Thank you, Chair, and appreciate the recommendations here and the dialogue. So I have two main comments. Number one would be, we actually just had a good conversation with behavioral health, and I don't quite see how behavioral health is incorporated here, except for obviously in regards to just their standard services they're providing as people are entering some of our housing solutions. And so considering the high number of individuals that are unhoused, that are suffering also from a mental illness, I'm curious how we see behavioral health fitting into these recommendations.
So that's a great question. And let me take a crack at it, and then Consuelo weigh in on the pieces I've missed. I think that we, as part of the plan to end homelessness, there is a component that is really directing us to focus some subset of our mental health services on people who are homeless. And one piece, big chunk of that work is something that we discussed a little earlier, which is the gaps analysis. So I think that, you know, if the committee, for example, wanted to say, yeah, we'll support X, Y, and Z, but we want a heightened level of concentration on behavioral health, that would actually be helpful, because there's some other issues, and I'll just use one that's not included in this, but it's a discussion I've had with staff, and a recommendation that I hope to be bringing forward is that I think we need to restructure, for example, the public guardian's office and the role that they're playing in terms of being able to provide, to expand the number of people who can provide assessments and then make sure people are in permanent housing, as an example. So there are components of the plan to end homelessness that have behavioral health, but I think it's okay to say we'd like to emphasize an increase in services for people who are homeless.
Yeah, I think that's certainly a need that we have, and again, I think it should go without saying, which that's kind of where my concern is, though, is that it's not really said right in the recommendations. But when we're potentially going to be increasing some of these solutions, I think we have to recognize that the increase there is going to equal an increase in some of the behavioral health outreach work that's going to go on, and work that they'll do to link people to services. And so I didn't quite see it spelled out anywhere, and that's why I wanted to raise that.
Yeah, and actually, let me just add one other thing, Raul. I'm really glad you jogged my memory on this too, is that remember that the focus of this committee is really item 4, which is what are the recommendations we want to make. Having said that, I think the point that you raise, the reason that, again, like what I like about what you're saying is what we can add to 4 is that the commensurate services that the county is going to need to be able to provide at some point are going to need to be mapped out, and sooner rather than later. I think that's what you're saying, and I like that a lot. Does that make sense as
Yeah.
attaching it to item 4? Okay.
Yeah, that's it. I think, yeah, just like I said, I think it kind of goes without saying, but I actually, in reading it, I felt, yeah, I felt like we should just say it. Yeah.
And Supervisor Chavez, great question, council member. I think for the county, this is where the recommendation number 2 comes in, right? So we have to develop our own implementation guide that includes that additional behavioral health component.
Good point. We'll add it to 2 and 4. Good. Thank you.
Great. And then the last piece is really, an interest of mine personally, and Cindy, you're aware of this, but to be able to keep something actually going with this task force, and not necessarily as robust as we've been doing here, but I think there is a big need, and maybe it's on an interim basis to kind of follow up with the work that we're asking to be done here, with the recommendations that we're asking to be done here, and have a convening with individuals like that are on this task force, and maybe it is an invite with the same individuals that are on the task force. But also, I think, as we saw with the presentation today, I don't think behavioral health, right, should be necessarily just a component of a presentation like they were today. I think that they, should be kind of a regular piece of that, as we know that they are already. But I also think a couple other voices that we are missing, and they came up in the conversation today, but that's our police, our public safety officials, that a lot of times end up being the first individual to go and encounter somebody that's unhoused, be it, a call for service for someone because they're sleeping out in front of their property, or they're suffering from a mental health breakdown, and somebody's calling and they happen to also be unhoused, or a number of calls I know that come into our officers. But just, I think that would be the main interest, again, is some form of continuation to follow up on these recommendations. And again, it could be this body. I think, a lot of work, as you pointed out, went into forming the members of this body. And I just feel that this is certainly should be risen to a high enough crisis that us as leaders across the county need to address it, and need to come together more regularly than we have to date. I feel that this task force has really been a great opportunity to get so many different minds, and for everybody to almost level set, right, on what the challenges are, what the realities are. As you pointed out today, a lot of just honesty of, we don't have enough solutions. We know it. We don't have enough housing, from permanent supportive housing to the interim solutions we're talking about today. And it speaks to the need as to why, for instance, as you mentioned, the need to create, this large envelope of opportunities in every single city rather than just picking a couple options. And I'd love to follow up on that. I'd love to keep something like this, again, on an intern basis going. So I've said it enough repeatedly too much, so I'll stop now. That's my second comment. Thanks.
Thank you so much. And then Councilmember Ramirez?
Thank you, Chair. Do you need a motion to advance the
Yes,
recommendation?
anytime anybody wants to do that, that's totally acceptable.
I'm happy to move the recommendations as prepared here. And then just a couple of quick thoughts.
Great. So
I
we have
think
a
this is
motion. Do we have a second on that motion?
I'll second. This is
Thank
Rod
you.
Sings.
Thank you. And I'm taking notes on what everybody said, so I'll figure out a way to put them in at the end. So don't worry. People have to jump in. All right, Lucas, go ahead.
great. Thank you. I think this is a great start. I agree with what Councilmember Peralta said about finding some means by which we can sustain the momentum that we're creating here. And I like the recommendations and in particular, how they've been fleshed out in the packet, the regulatory changes that are suggested and some of the ideas that cities may wish to explore to address the needs that we each have in our own communities. I know this is probably well beyond our scope, but down the road, we're all working on the RENA the figures and everything, and it would be nice to think about some kind of accountability mechanism that would help guarantee the desired outcome. There's a robust process with RENA, right? The housing element, we have to identify sites, and if we aren't successful, then there are some penalties that come with that. And I'd like to be able to work with the county to find ways of incentivizing compliance and being a part of the solution, and maybe figuring out ways to discourage things like suing the county and the state when they provide free money to create supportive housing. And it's counterproductive. So something to think about. What can we do to help?
No, I got you.
Right. I'd like to think about, I'm thinking within my city, we had a robust conversation last week about a city-owned property in downtown, Lot 12, where the council has expressed interest in developing with affordable housing. And we ended up supporting utilizing Measure A, a new option by which we would work with the county to address some of the unique needs of Mountain View. And while I was happy with the outcome, one of the things that became clear is many of my colleagues really want to make sure that we're helping our own first. And I know that there are logistical and regulatory challenges to making sure that only the folks, or not necessarily only, but prioritizing the folks within our own cities, in the new interim housing or emergency shelter that we're creating, that's not always a possibility. But when a city, I think, tries to make a good faith effort to be a part of the solution, and maybe this option 3 that we ended up supporting with Lot 12 could be beginning of this. It would be helpful to have some allowances for helping us be able to prioritize particular populations within our own city. It's not something that we have to, incorporate into the motion today. I think it's just more longer term. I don't want to have to keep having this battle of, should we use Measure A? If we do, then we can't guarantee that only Mountain View folks will be housed, and which is an exhausting battle to have project after project after project. But instead saying we recognize that This is an important source of funding that we can leverage, and we can achieve our community goals, making sure that we're, helping folks who are on the streets in Mountain View transition out of homelessness and into permanent supportive housing, without this fear that it's going to be infrastructure created for the benefit of other communities. So I share that, not because I necessarily share that feeling, but it's something that we've encountered consistently for, over a year now. And I'd like to work with the county to figure out a way where we can move past that. And if we're making a good faith effort, maybe have some relaxed rules to allow us to address some of our own community goals. But beyond that, I think this is a great start, and I look forward to implementing these in my city. Thanks.
Thank you. Rod?
Well, it's a privilege to go after the council member from Mountain View, and I agree. We ought to look for, arenas were semi-baked at ABAG last week, and we all have a lot of work to do. It's really clear. Well, and so, in my city, this has been a real struggle, frankly. I think the opportunity here is with the right carrots and yes, maybe sticks, all of us participate in this. I'd really like to see Cupertino follow Mountain View's lead and have those questions, work through those questions. Everybody on the council says even my current council says they support affordable housing. So let's have that discussion and see what we can get done in each of our cities. I do have a couple of reports. I talked to my city manager. She feels confident that our city is in alignment with these 4 draft recommendations. So I feel at liberty to support this. She said in particular on number 1, that our housing commission on October 14th met and recommends this plan to the city council. It's slated for an agenda in December. We've been involved with the local Safe Park program as well as the De Anza student housing program. And as some of you know, we have a substantial homeless encampment on Wolf Road. So at this time, we're highly motivated, I think, to participate in all of this. And yeah, I just really appreciate hearing from Lucas and the experience Mountain View has been through. And it's, it's tough, but we need to be having those conversations because we need to work on this problem. And when we go to allocate the RENA, we are going to be in this game big time. So in the meantime, we've got to work on number 4, right? All of these things that we can do to handle the situation more immediately. Thank you.
Thanks, Rod. Mayor Scharf?
So I'll echo what Rod said. I think our council is all in on this. I was on the ABAG meeting last week as well. And I think it's important to point out, just like the current cycle, every city will create an HCD approved housing element. And just like in the current cycle, getting that actual affordable housing to be built is going to require substantial amounts of funding from somewhere. Obviously the cities, we were looking at the amount of money it would take to build all the affordable housing we would probably be tasked with. And it was billions of dollars considering how much it costs per unit. We had the first Measure A project in the county at the Veranda. It was $800,000 for each 350 square foot studio. So this is an enormous amount of money. And, I look at which item is it? Item 3, identifying resources, including money. But what are we doing in terms of trying to get money from the state or from corporate interests that really, with the tax cut by the federal government, they reaped billions in additional tax savings, which is starving us for funds. So yeah, we're all in, but like most cities, we don't have billions of dollars in money to spend on this. We have to get it from the state or federal government or from, our wealthy corporate employers. Thank you.
Thanks. Let me see. I think it's Maya.
Sure, I'll go.
I'm sorry, I have to turn the light on in my office. I'm blind over here. Go ahead.
Okay, mine goes out automatically too every now and then, so I have to get up and walk around. So a few thoughts. One, I wanted to echo, and I forget whose name it was, but his comment about thinking of it as a suite or menu of options. In number 4, and then a question is, do we then as cities take arena approach where these cities have these numbers to hit, right? So I just wanted to bring that up. Lastly, or not lastly, I have a couple more. On the reconvening, I actually agree with that, with the added suggestion of as cities, and I know it's a little bit more work, but as cities, we report back on where we are on 1, 2, 3, 4, and 5. And that gets tracked. And when we hit these milestones, we come back as a city, because I think I don't find it particularly helpful to meet just to meet. I don't think any of us do. And so, perhaps we take a milestone approach to the next step and the next step and the next step. I also agree with my colleague, Councilmember Perales, about public safety. I think we're having a lot of concurrent conversations in our community right now throughout the county about policing and period, and then different cities in the county. We're all trying different things, and I think that that's an important voice to add. I wanted to also bring up the services issue. If we could include health services at sites and locations, I bring that up. I know everybody's experience is different. Based on mine and District 7, I think it would be really helpful if we make sure that when we have a shelter, and because that's what we're talking about here tonight, that we really are very explicit about all the types of services that we're including at these locations or making accessible to these different locations. I think health, behavioral health, and mental health are critical to having this all work successfully. And lastly, I had a question, and I felt kind of like ignorant that I didn't know it. And this is a question for Consuelo. Consuelo, does a shelter, when we do our surveys or we pull people into a pool for permanent supportive housing, for their most recent address, do we look at a shelter address? Is that the most recent address?
When they first get assessed before they enter a shelter, it's how they answer. It's their last known address. And then when they enter the shelter and if they get reassessed again, that may be their last known address. So
Okay,
it depends on how they answer the question. Mm-hmm.
Okay, so it's self-reporting, yeah. And it can vary, right?
Yes.
Okay. I wanted to ask that because I felt really ignorant as all these conversations were coming up. And I've heard a phrase a lot. I think we all hear it a lot, which is our own. We are one county. We have, for a whole lot of reasons that we heard at the first meeting, I know I missed it, but I read all my stuff, that we have a countywide system that is there for everybody that needs it. And maybe part of implementing number 4 is a toolkit for us as elected officials and community members to speak about that care, that coordinated entry. What does that look like? What does that mean? because our own is us. We are our community. And yes, for whatever shelters or permanent supportive housing, we really try through our providers to do intensive outreach in that immediate area to really show the impact, the positive impact of bringing in permanent supportive housing or shelter or whatever it is to that area. But at the end of the day, we have a countywide system that makes sure that if you are a homeless family that needs help and there's an opening at the family shelter in East San Jose, that is available to you. Or that if you are a homeless veteran, that you have some specific options that are available to you no matter what city you're from. And so I think that we could really benefit from having a little bit more, some more tools on how to speak to that and describe that a lot better so that we can kind of get beyond this, our own discussion. Thank you.
Thank you. Taking notes. Anthony.
Thank you, Chair. I kind of wanted to touch upon what Councilmember Perales said about ongoing work, but I wanted to take it a little further. In this county, there are over 70 boards and commissions that report to the Board of Supervisors, but none that actually speaks directly to unhoused or homelessness. Yes, there's the VHHP board and there's the Housing Authority and I believe the COC, but none of them actually, all of those deal with the metrics within their programs. And I would suggest that one of the suggestions that go to the board is that a commission be made specifically for the topic of homelessness and that it include each of the 13 counties as a member, but also have a 60% component of those with lived experience within those counties. Because as we know, experiencing homelessness in Gilroy is different, a lot different than it is in Mountain View and Milpitas and even San Jose. And so like, I believe that if that were to be done, a lot of the things that go on within these areas could be addressed in real time and brought to the board in as per the recommendations to go forward with the help of Office of Supportive Housing and the Continuum, but also maybe spot trends that we fail to see or don't come out in our point in time counts. That was it for me.
Thank you. Kelsey?
Thanks. So one thought that I have just in general, I tend to be very optimistic, but I do feel like the title or time frame, I don't think we're going to end homelessness by 2025. And part of that is I don't think we're going to be able to build the housing fast enough, which I think is one point that I want to make in terms of the cost of these solutions is that time is money. And when the process gets dragged out for years and years with litigation, that ends up increasing the costs. And that it also matters how many units are allowed. I think the housing in Cupertino was something like 11 units. It wasn't very much, which makes it the per unit cost more expensive. And I think I also want to agree with council members Ramirez and Esparza in terms of this all being one region. My experience as a provider, I get very annoyed with council members saying we only want to house people from our city because my experience as a provider is sending almost everyone to San Jose because that's where the services are for the most part in this county. So it just generally doesn't work that way. And I wonder if I can make a friendly potential amendment. I don't know if it belongs in these recommendations, but one thought that I have is if the main point of this task force is improving the quality of life for people who are unhoused, there are a lot of things that the government does that I think actively diminish people's quality of life. So things like various punitive strategies that are used. So like ticketing or sweeps where you're taking people's possessions, which can be a traumatic experience. So if there was some statement about not using punitive measures that I think can be really harmful to people who are unhoused.
And let me just say, really, the focus of this task force is really item 4. And that is, can we encourage people to build interim transitional housing in their cities? That doesn't mean, Kelsey, that we shouldn't just add it as and here are some overarching themes that the group had. What we're going to do is take the recommendations. We'll do a cover letter with the themes that don't exactly fit in the recommendation we've been asked for by the board. And there's no downside to doing that, because if you know, and I'm giving this thought as we're shaping this about how to incorporate it and what the outcome of that could be for everything you all are saying. All right, anything else, Kelsey? Nope. All right, thanks. Jerome?
Okay, so I definitely agree with what Kelsey just said about the punitive, solutions. Like, we need to stop a lot of the ticketing that goes on to homeless individuals, because it just sends them back way far back. So I think, like, for recommendation 4, which is what this committee or this task force is all about, there has to be like a real vested, genuine commitment from the cities to want to have like major change in their cities, and from the county too, because as we're talking about doing things in the future, we have to think about the things that we're currently doing also. Like the individual that called was talking about the hotels possibly closing or individuals losing their placements in hotels. It's like I don't understand why, if there's a hotel in your city right now that's hosting homeless individuals, why that hotel would even consider being closed. I know just like the city of Sunnyvale almost conducted a sweep on homeless individuals at a park, and we're still talking about how we can improve the quality of life of homeless individuals. It's like there has to be, some consideration of like what's going on currently, and not only what we can like do in the future to improve like quality of life or get homeless individuals off the streets. It just seems like counterproductive to close a hotel or conduct sweeps during this time where we're trying to figure out how we can find solutions to end homelessness or improve the quality of life of homeless individuals.
Thank you. Anything else, Jerome?
No.
Okay, thanks. Mayor Klein.
Sure. And just on what Jerome just said, there was a lot of misinformation in the community. We've been working with Downtown Streets team and Sunnyvale Community Services for a homeless encampment at one of our parks that is currently planned to go under renovation, and working with trying to place those individuals. And some of them were, let's say, non-responsive to Sunnyvale Community Services. But, it's those sorts of things. It's finding services, it's finding locations. And it's that partnership of not just what our cities are doing with our service organizations, but of course with the county. And so, we've never done a sweep of parks, and the chief was like, our chief of public safety was, we have no plans to ever do any sweeps of parks of the homeless in our community. And from that standpoint, it's like, I was happy to hear him say that, unhoused is not a crime in our community. And I think that's what I hope most of our police and public safety vision is, as far as that's concerned. As far as, the collaboration, and I want to thank Cindy for what this process is. I did want to bring up a few possible issues, one of which is, the resolution to endorse this by all of our cities by January. I do think that getting some other, we could easily do that from a council standpoint. I do think it's important that our commissions also get appropriate time to go through this. So there might be a timing issue with hitting that January goal, but I do think it's important to get more, more buy-in from that community, from our boards and commissions that give recommendations to council and also kind of go through the series of recommendations. And ultimately, this is a collaboration. I'm happy what the county has been able to do with our Hamlin shelter in the last few years. It's working with the county, moving it to all year as opposed to just a winter shelter, a cold weather shelter, and then expanding the number of beds from 125 to 175. Of course, that's now reduced under COVID, and how COVID plays into all this also has to be played in, put forth in our plans as far as, we can expand, but those expansions are also limited during the current measures that we're having to deal with. So I do think, this takes a partnership and coming back as has been previously suggested, of bringing the representatives of different communities back together to talk about what's working, what's not working, as we go forward. Is it every month, every 2 months, to figure out, what is best practices and what's actually continuing to work, or what hiccups in the road are we finding, as we look at, inclusionary housing and, ultimately doing the right things from a city standpoint only goes so far. It's getting the appropriate funding and then figuring out the right solutions to house as many people as possible. So I think that's important, but it's that collaboration across our borders. It's looking at all 15 cities and the county on what the right solution is. So I want to thank you for what we've done here, but also, trying to look forward at the next practices, next steps, and figuring out what the best practices are. So thank you. You're muted, Cindy.
Sorry, thanks, Larry. And I was going to Vice Mayor Smith.
Yeah, thank you, Chair. I just wanted to add my support for committee member Peralez's suggestion that we add the behavioral and mental health aspects to number 2 and number 4 in your letter. I have been talking to some providers and also some residents who have noticed that there is a gap in Sunnyvale services for persons who are homeless and mentally ill. So I do feel that there needs to be some accommodation for that, and look forward to your adding that in the letter. And I'm supportive of the motion. Thank you.
Thanks, Nancy. Yvonne?
Thank you, Madam Chair. So I have a couple of comments and possibly some recommendations. I see this going similar to, with the governor having said his efforts towards homelessness, and as he said prior to that, his efforts on building housing. And so we know what he's done with the housing, and I think that what's coming next is the effort to end homelessness. And so I'm glad that we're getting this jump start and really moving ahead, and I can't commend you enough for that. I agree with Councilmember Peralez and his really request to see if we can continue this going. I think it is so important, and I really appreciate the support, not just on the topic, but working with a group of people who are having, so it's such a complex topic, and having all of the resource that you're providing for us to get us kind of all at the same level, so that we're able to really talk intelligently about solutions. And so I think that is so very valuable. And we had a conversation, the mayor, myself, our city manager, our housing team. And, one of the things that he was talking about is important, is that we're all doing the same type of strategies or efforts in the county. So we want to know that we're taking this initiative and we're running it with it, that Gilroy's doing it, that San Jose is doing it, that everybody else is doing it, and then we're able to also share. So one of the things that I learned meeting with that group is that people need to be housed, yes, in our community because they have social and family ties, but also, and I think Kelsey spoke to this last time, Kelsey, thank you for that point, but some also need to relocate. So if you are dealing with substance abuse and you're trying to get clean, it's not necessarily the best place for you to be in your community. And so you also have people who need to relocate. And so I think that's where it becomes very important for us as well as sharing this as a community and regional issue, is being able to have that conversation of and options of where people would be able to go. The other thing was listening and understanding the case managers and how very important our team felt that they are to the success that we have. And I guess there's almost this type of a cue when we have the mobile crisis unit and they're put in, people are then, we can account for that they may need services. So they go into the system of identifying who they are and what they might need. And if we're all doing that, and having more access to case managers, that would also help us identify things like this gap analysis that we're looking for so that we know what the need is for us to be servicing. And so two of the recommendations that I'm just suggesting would be, one, that we add to this, in addition to building these different types of, of shelters to address emergency homelessness, but also that we do have more case managers with that included, those services included with all of these. And also that we perhaps add facilities for those who are not able to be independently housed. And again, I want to thank Kelsey for her comments on that, because it's a different site that I didn't think about. And of course you would know much better that people are able to once they're in a different situation, but I still do worry, and it certainly isn't an interest or desire to have people in locked facilities, but I do worry about their well-being if they are not able to take care of themselves. And some of the stories that I've heard anecdotally from our law enforcement, and one of them was hundreds of times that they've tried to help this woman and they just feel horrible not being able to help her. And so and then I also wanted to just say that, maybe I think that the county, if we could identify the group, what is needed, and almost have a list of what is needed, like a menu, right? And then this is what our, this group was talking about, the housing team. And then if we were able to almost offer, this is what we could help with, as Morgan Hill or whichever city. So I think, yes, my colleague is correct. We need that flexibility, because perhaps maybe a big city might be able to do something else really well, but maybe, as a small city, we might be able to do something like housing, a shelter for single men that might not be as easy, or not easy, but as maybe socially, with political will in your community, have less pushback than doing for youth or something. But if we're in a small city and we're able to do it at a smaller size, and our police department's able to have a really strong relationship, that might be successful, more successful. And so I think we think that it is very important that we have, if we can understand what is needed countywide, and then how we can help solve the larger problem, best utilizing and leveraging our local resources. Thank you.
Thank you. Mayor Lawler.
Hi, thank you. I just wanted to put in my 2 cents. Briefly, I think the important component to this is shifting perception that we talked about early on in our meetings. And my suggestion would be to all cities and agencies with respect to their implementation guides and in addressing emergency solutions to use language that is more focused on humanitarian relief, such that, just like Ms. Crabtree had recommended. I thought that was a good recommendation. Because my feeling is that the term homelessness can often have a stigma to it. And if we want to have our communities embrace solutions for homelessness, perhaps getting rid of the stigma and using words more like humanitarian relief for the unhoused and things like that will help people come around, if you know what I mean. So that's just my suggestion in terms of language. Thank you.
Thank you. Councilmember Bybee?
Thank you. I appreciate the opportunity to serve on this committee. I'm fairly new as a new council member to the city of Campbell, but I've certainly learned a lot in listening to all the dialogue. And the main takeaway or one of the main takeaways is that it sounds like there's been a lot of dialogue over the years about the homeless issue and the unhoused issue. And we don't seem to get any closer to a solution. And I think this task force is a good way to at least start to move towards that. I agree with a lot of the speakers. I believe that it is a regional problem, and it really involves all of us as a partnership and a collaborative process with the county and all the cities and all the parties that are involved, behavioral health and others, to really come up and try and address the problem and come up with solutions that we all can buy into. I do support the formation of the county committee. We have a lot of other committees that as council members we serve on, in the areas of transportation and solid waste and whatnot. And I'm not advocating that we meet monthly, but even maybe just a quarterly meeting to discuss this and track the progress that's being made. And then the other item, I agree with Mayor Klein about the timing of the endorsement by January. I think that's a bit ambitious. Particularly there is going to be an election in November, and we're going to have a change in council with at least one council member. And I think it's important for new council members, new electeds, to be able to buy into the recommendations and have an understanding of it. And I think the timing of January 21 is a little ambitious, particularly for my city. And I just, again, appreciate the opportunity to serve on this task force.
Thank you for that feedback. We have 4 more speakers, and then I'm going to ask if we can wrap it up because we still have public comment, and I want to do a motion here too. So we have Councilmember O'Neill.
Thank you, President Chavez. First of all, I probably should have asked this question a long time ago, but once again, it's just come up very recently for me. Is the role of the water district in this whole process? Because I know in a number of cities, and in my city, we have several creeks that run like almost the whole length of our city. And, right now I've got some issues in my district related to that, and, residents expressing frustration. So I just didn't know what communication has gone on with the water district, and in terms of their willingness to participate, or what they feel like is their jurisdiction and not, because I know that they've been kind of resistant right now. And I realize that, with COVID, it's different, but we have, as I know the people in San Jose really know, because they've dealt with like just even the sanitation issues, but just as I get worried that if we do get rain this winter, because I know I'm hearing, I've got to go down and take a look, that, that we've got increasing people living down in the creeks. And I think the police are hesitant, there's that whole issue. But I wanted to also say about the January timeframe. I know a couple years ago, we had a horrible example of something that happened in Santa Clara, where we wanted to try something very innovative and involved the county and the John Sobrato Foundation. And it got sabotaged because we didn't have enough time to do the right communication, and it totally blew up into a disaster. And so that's a little bit of my concern about the January timeframe, is that you know, we've got a community that's very kind of anxious about a lot of different things right now. And so I think we do need to really have a chance, the timeline, to talk with them and hear them and say, okay, this is, you know, do we agree that this is a goal that we need to go after together, rather than they think that their city council's trying to impose something on them. So maybe a little bit of leeway on when it happens. Okay, thank you.
Thanks, Teresa. And our last speaker on this item is Councilmember Prowlis.
Hi, thank you. And I just actually had a request to see if we could amend the motion. Hearing a number of speakers say that they agreed that some form of reconvening would be beneficial. I don't necessarily want to dictate, you know, that that's monthly or quarterly, but I do think we want to be able to get back together.
Yeah, I'm going to make a recommendation on that, Raul. And if it doesn't meet the group's needs, then I'm going to get feedback on that right now.
Great.
So we have a motion and a second to move these 4 recommendations. And I'm just going to tell you what I'm going to recommend we put forward. And that is that to item 2 and 4, that we add behavioral health service expansion under both 2 and 4, and probably a little bit more of customization. I'm going to recommend that we reconvene in April, and that we change item 1, that all cities within the county will endorse, instead of by January 2021, that be done by March 31 of 2021. So we would convene in April to look at the milestones. I thought that language was very good from Maya. And that we would add to that convening, instead of just doing a committee meeting, handle it more like a workshop so people can get up and say, here's what we've been doing. But it would also allow us to add the police and the water district and behavioral health and a bunch of other partners that have come up throughout the night, so everybody can participate. That we also recommend to the board that we have all of item 4, A through F, reviewed by the community with lived experience to determine the pros and cons of each of the models, and to make that information available to each city and the county. That at the April 4th, our April convening, that we have the educator's toolkit that would look at the processes and procedures, even a VDAT, SPDAT, how people get in and how they come out. And I think also communication tools, and I think Mayor Lawler mentioned that. And that in addition, that we, as the cover letter to the board, as the cover memo that will come from Supervisor Ellenberg and I, would highlight the interest in the ending of punitive measures relative to houselessness and poverty, including tickets and other kinds of punitive measures that just set poor people back. And that as part of that letter, we highlight the high level of interest in the additional, enhancement of our continuum of care for placement facilities of all types. That's what I heard you all say. How'd I do?
Great.
Great.
Kelsey?
I just have one kind of concern about adding in behavioral health, which I agree, behavioral health we need to improve those services, but I just don't want to obscure the point that we need the housing is like the fundamental need if for ending homelessness. And sometimes you'll hear people say homelessness is about substance use, or homelessness is about mental illness. And I don't want that to come across in these recommendations. So that was
We got that. And we can do that without making it, I got it, Kelsey. I totally understand and agree. So I think I can shape that.
And that can be
Tina?
included in the communication toolkit, because I think that might be helpful.
What's that?
And if that language, to her
Yeah,
point, that language
absolutely.
in the communication toolkit.
Yeah, actually what popped into my head, Maya, was a really good analysis that was done about how people get into homelessness. And so I actually think it should be part of the April presentation. Like, you know, sickness, loss of job, you know,
Eviction, job loss.
Right. It would
Yeah.
be hard not to be on the street and not become mentally ill is the bigger issue. We got to keep people from getting in that situation in the first place. But yeah, got it. Antonina.
I don't know if this is the right place to put it in, but I didn't hear anything about the homelessness prevention program, the budget in order to increase that so they don't.
Yeah, because we're focused on a subset of so we already have prioritized, the county writ large is prioritizing homelessness prevention in a whole bunch of different areas in a different body of work. But I'm happy to include it in the letter as something that was raised to reinforce that there's a high level of interest in the board continuing to invest as we are in that body of work.
I appreciate that. Thank you.
So Scott, I hope you're taking excellent notes. All right, Antonina. I'm sorry, Mayor. Thanks, Antonina. Yvonne.
Thanks, Cindy. I wanted to just see, so 2 and 4, the behavioral health, that would include the case managers, I'm guessing?
Yes.
Perfect.
And actually, I wrote that down in my notes. I just didn't say it out loud.
Okay.
Yes.
Thank you.
Anybody else?
And
What's
health.
that?
And health.
I'll add health.
Thank you.
All right. Anybody else? And this is, you guys, if this is your time, so I don't want to, but I do want to make sure we get to the public. So I'm going to take Kelsey and I'm going to take Lucas, and then I want to take a vote, and then I want to get to the public.
I just had one more thought about the kind of locked facility conversation, and thinking about the fastest growing segment of the homeless population is the aging or seniors, and like the need for, and maybe this fits under the health umbrella, but like there's a gap in services, I think, for people who have dementia and various other issues.
So Kelsey, rather than listing that, what I said was additional enhancement of continuum of care. And that way today we don't have to decide what that is, but it gives us a chance to finish the analysis, because you're totally right. Lucas?
Thank you. Did you want all of the additions that you've listed included formally in the motion, or is that part of a separate cover letter that
I'm going to put
will...
I'm going to put everything that wasn't part of 1 through 4 in a cover letter, but we would be moving. So what will go to the board is 1 through 4 with the discussion of all of the issues that were raised, along with, actually there will be a 5, which would be the reconvening in April. But everything that you raised will be in the body of the document that goes to the board. When I said cover letter, what I should have said was the memorandum that comes from this committee to the board. So I don't need it if you're all in agreement, unless anybody's not in agreement with something on the list.
Supervisor Chavez.
If you want to amend the motion to add 5, I'd be happy to resecond it.
Great, thank you. Consuelo?
Sorry, I just wanted to note that in the presentation, we simplified the recommendations. There's actually 5. The regulatory changes are incorporated in the 3rd recommendation.
Yeah, I'm only
sorry about that.
No problem. I'm just using this slide. So I'm using this slide as my guide. I realized I had lots of different pieces of paper and then missing some. So
yes, sorry about that, Supervisor Chavez.
No, that wasn't you. Go ahead, that was me. But it goes under 2, right? 5 is under 2. The initial. I think Consuelo, you and I are on the same page. I added 5 to this sheet unless there's another 5.
It's just that in the staff report, there's 5 recommendations, and in the slide, it only shows 4 because we grouped 5 under 3.
That's right. So what I'm agreeing with you that 5 is in 2. We have a new 5, and the new 5 is the reconvening in April. Is that okay? All right. Yeah, okay. All right, any other discussion on the motion? All right, So we're gonna take an action on the motion, and let me just say we actually have to take two. We have to take this roll call vote, and then we have one more, and then public comment. So on the motion, I'm going to ask for the clerk to do a roll call vote.
Member Jordan.
Andy, you're on mute.
Sorry, yes.
Thank you. Member Haraz is absent. Council Member Bybee.
Aye.
Thank you. Mayor Scharf.
Aye.
Thank you. Council Member Bracco is absent. Mayor Pro Tem Martinez Beltran.
Aye.
Thank you. Council Member Sinks.
Aye.
Thank you. Council Member Dominguez is absent. Vice Mayor Nunez, absent. Mayor Lawler.
Aye.
Mayor Constantine is absent. Council Member Ramirez.
Yes.
Council Member Perales.
Yes.
Thank you. Council Member Esparza.
Yes.
Thank you. Council Member O'Neill.
Yes.
Thank you. Vice Mayor Smith.
Yes.
Thank you. Mayor Klein.
Yes.
Member Clark.
Yes.
Thank you. Member Reeve.
Yes.
Thank you. Member Atari.
Yes.
Thank you. Member Baines.
Yes.
Thank you. Member Franklin. Is absent. Member Sharp. Absent. Member Stepanoff.
Yes.
Thank you. Member Cooper. Absent. Member Pham.
Aye.
Thank you. Member King.
Aye.
Thank you. Member Shaw.
Yes.
Thank you. Council Member Niss is absent. Vice Chairperson Ellenberg.
Yes.
Thank you. Chairperson Chavez.
Yes.
Thank you.
All right. Thank you, everybody. And I know that's with a lot of reading, a lot of work. And so we have a couple more items. So we're going to go to item 2 was to approve our consent calendar. Item 4 is to approve a delegation of authority to me to review and approve all outstanding task force minutes on behalf of the Unhoused Task Force. So if I could get a motion for item 2 and 4.
So moved.
Thank you. We have a
Second.
motion from Supervisor Ellenberg, a second from, who seconded?
Yvonne.
Oh, thanks, Yvonne. Thank you. Second from Yvonne. And this, before we do a roll call vote, I'm going to ask if there are any public speakers on the minutes or on the delegation of authority. And if you want to speak under public comment, you're welcome to do that now. And that way we can just take public comment unless it's, now, if that's all right with everybody, just to merge it so folks don't have to wait. So if I could ask the clerk to call our public speakers.
Sure. Our first speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, Robert Aguirre here. I hope you can hear me.
We can.
Yes.
Okay, good. Yeah, the other day I couldn't get in. Anyway, yeah, I would like to have seen a lot more discussion on sanctioned encampments and exploring that idea of moving forward with that. Also, I think that we want to look at the idea that whatever ideas that we have already talked about is not going to solve the big problem. And I know you've already said that. So we need something in the meantime. And that's where I think these sanctioned encampments would be really handy. We could set up areas throughout the county and cities can cooperate with that so that we can have a safe place for people to be, surrounded by a fence so that it keeps out people that would otherwise disturb the people that are living within that encampment. And then have those people elect their own council of people to oversee the group and make sure that they all run smoothly and keep everyone safe. And then we can provide services to those people in a set position. And I think we'd be able to at least be able to help people much more than what we're trying to do right now. We can continue providing the same types of services like trash cans and fresh water and hand washing stations and porta potties and things like that. And other services, mental health, medical help, and other things can come in and help those people as well. But the idea of running it where you have a policeman or some security guard, checking on people as they come and go, I think it's unnecessary, and it's a lot more expensive. And it also causes people not to want to live in those conditions. I don't think you would want to live that way as well. And I'm sorry that I wasn't able to get onto the.
Our next speaker is Gail Ann Osmore. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hello, good evening, everybody. Can you hear me?
We
Yes.
can.
Okay, thank you. I brought this up a couple of weeks ago with another committee meeting that you all had. And I know you just voted on this recommendations, but no one has looked into navigation centers. These are really, really important. They are, they have some in San Francisco, at least 3 of them. They have one in Fremont. They are wonderful. They can house up to 100, 200, 45 people. It's a very good way to house. They do have services, and this is something San Jose needs to look into. We do need to have navigation centers, and I would really hope that we can recommend that this could be item number G, even though you already voted, but this is something very important to look into. And another thing regarding what Robert Aguirre said, I just want to say, which I did say, I have a safe camp in San Jose. It's not a sanctioned encampment, but it's called a safe sleeping zone. And there's 7 people living there, and it's safe. We have a porta potty. They get food, and they police themselves. There's no rock and roll, no drugs, no nothing. And there's only 7, but we need more in every single council district. We know that certain people, like the mayor, will never approve a sanctioned encampment because he said that often for years. But I have a safe sleeping zone where 7 people can sleep and rest and not be interrupted or get hassled or be swept every other day. So that's all I have to say. I would like to say navigation centers, very important. Thank you, and thank you for your work.
Our next speaker is Leanna Crabtree. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. I sent my comments in writing already. I hope that you've had a chance to receive them. I realize that you are probably overwhelmed with written comment. And so on the topic of sanctioned encampments, I agree with the other speakers who have spoken to this topic that this is a growing need. And in my comments, I did identify that I hope that you will consider increasing the humanitarian relief aspect of the offerings. In the matrix that was part of the packet, I believe it was page 10 of the tonight's agenda packet. It's the services that were suggested were very limited. I just case management, of course, very important. Toilets and garbage service, but for the dignity of humans, they need an opportunity to be able to stay clean. Human beings need an opportunity to preserve their dignity through hygiene. And so I really hope that if encampments are something that is going to grow, and I unfortunately think that it is, and I say unfortunately because we would certainly much prefer that people were in stable housing, but the dignity services need to be increased to regular service with showering and opportunity to wash clothes and even dental services. So please keep that in mind. And the other, we're dependent. It seems we're dependent on what the state tells us we have to build for housing. And I'm just going to keep hammering this home that we really need to look at what is the actual inventory of housing today And what can you do? Vacancy taxes. What can you do? You know, stiff fees on hoteling use of housing, things that really discourage housing being used for uses that are not related to housing at all. Because people should be able to, you know, they should be able to buy housing, you know, be able to find housing in their.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
All right, thank you everybody. Scott Largent. It was interesting to hear several of the speakers talk about punitive measures, pretty much criminalizing poverty and homelessness here in Santa Clara County. A lot of the citations that the homeless are getting now, they're not going through the traditional channel at the Hall of Justice. These are going through traffic court. The homeless person, whoever's met, whatever they are, they pretty much do not have an attorney. And a lot of your cities, and I know we have a lot of different mayors, city councilmen, everybody's hands are dirty with what they did to get people out of their communities. This went on for a very, very long time. City of San Jose started issuing tickets. One of them was to a combat war veteran, and he received a Muni Code violation for living in his motorhome right near City Hall. He had to post $2,800 bail to be able to have a court appearance. There's also a very, very nice woman that I've gotten to know. Robert does a lot of wonderful work for this woman. Her name is Simple Rose, Sumi Rose. A stay-away order was issued by a neighbor across from the Safeway in Campbell. They listed 14 people on there, and they basically ran her through civil court. Well, the only problem was Rose was incarcerated at that time, and she was out at Elmwood. She was never taken to her civil court appearance. That has now dominoed into about 7 different charges. Okay. The list goes on and on and on. Every one of your cities is involved in this type of dirty deeds. I would like to see the water district involved, Caltrans, law enforcement, and like I just said, the courts. We need somebody to get on here from the public defender's office or a judge. And I have talked about this. I know I'm going to get the axe here in about 10 seconds. What about homeless court? We need to really think about that. This has worked in other counties and states. So thank you.
Our next speaker is Scott Pearson. Scott, I'm unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Okay, my name is Scott Pearson. I'm 2 months shy of 69 and I've been homeless for 5 years. I right now am in the COVID-19 program, the room key program at Motel 6. I apologize, I am not a public speaker, but this is more.
Scott, you have to unmute yourself.
Is it unmuted again?
Yeah, there you go. We can hear you.
Anyway, I think this room key program here at the COVID Motel 6 in Campbell, there needs to be a way to save this. Our options by county staff here, we're told, is to go right back into shelters. I came here because of medical reasons. When I got here, the first day I was told this is a system that is a program that is ending. They already told me before I'd spent a night here, it was ending. This program is saving me. My health has gotten better. But as far as why they're closing, Mr. Shaw, you need to talk to FEMA. And why, to me, the project Home Key is a step backwards. We're actually losing facilities, places to keep homeless in. You know, I got so much to say and I just don't have the time to say it, but this program, there needs to be some way diverting Measure A funds. I don't know what it is, but these motels need to be absorbed into the system for these people. For every mental person that's out there, there's a person without any issues, medical, that needs this program just as much. When I first got here, my former primary care physician called me and said, Scott, I'm glad you're there. If not, you would die. You will not survive COVID. Thank you.
Thank you.
Our next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
All right, thank you. It seems the housing forgiveness intentions of AB 3088 has left ourselves short in some places in the next few years. As Mayor Liccardo of San Jose has politely warned recently, we may be headed for another foreclosure and recession crisis in the next few years. I feel we have to very much learn to be open and trust the funding and financial systems being developed at the state level, and learn how to better develop AB 3088, as the COVID-19 virus itself seems it will take a couple more years to wane. Although I try to keep my personal partisan feelings out of my speeches to local government, in the good reasoning of how technology and surveillance can be a combined open effort of the entire community, I think Joe Biden and a Democratic Party administration at the national level can very much help develop both conservative and progressive good choices for the funding and financial issues at the state level that will be needed for the next few years. Regionally, the MTC has to really want to develop their BAPA process. They have to learn how to reorganize, facilitate, and unlock the current practices and bureaucracy at the state level, and really work with some already well-developed good ideas from the local level of governments and their advocacy and local community advocacy, and what can be important new concepts of VLI, ELI, and mixed income housing. From Fremont to Redwood City, this is 3 counties across the South Bay that may be finding incredibly good ways to develop housing, equity, and the future of community with less use of a police department. With 15 seconds left, it seems that I hope all of this, to conclude, we simply have good ideas we've all been dedicated to pre-COVID-19. I hope we can continue those good ideas to define the future of positive sustainability. There was a good meeting to the Senate.
And that concludes your speakers.
Thank you. So the item that we're moving is item 4 and item 6, and it's the approving the delegation of authority and also our consent calendar, which was the minutes for September 9th. So we have a motion and a second. Did we have a motion and a second? I thought we did. Who made the motion? Oh, Susan, that's right. Susan made the motion, and who made the second?
Yvonne. Yvonne.
Oh, Yvonne, thank you so much. We have a motion and a second. I'm going to ask for a roll call vote.
Member Jordan?
Yes.
Member Haraz is absent. Council Member Bybee?
Aye.
Mayor Scharf?
Aye.
Member Bracco is absent. Mayor Pro Tem Martinez Beltran?
Yes.
Council Member Sinks?
Aye.
Thank you. Council Member Dominguez is absent. Vice Mayor Nunez? Absent. Mayor Lawler?
Yes.
Mayor Constantine? Absent. Council Member Ramirez?
Yes.
Council Member Perales?
Yes.
Council Member Esparza?
Yes.
Council Member O'Neill?
Yes.
Vice Mayor Smith?
Yes.
Mayor Klein?
Yes.
Member Clark?
Yes.
Member Reeve?
Yes.
Member Atari? Member Antonina Atari?
She said, go ahead, try it again. Yes, she said yes. Her mic's not working.
Okay, thank you. Member Baines?
Yes.
Member Franklin is absent. Member Sharp? Absent. Member Stepanoff?
Yes.
Member Cooper is absent. Member Pham?
Yes.
Member King?
Yes.
Member Shaw?
Yes.
Councilmember Niss is absent. Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes. So let me say thank you to all of you. We do have public comment, but I did let everybody speak on an item that wasn't on the agenda. So formally, I'm going to ask if there's any public comment, and this would be to speak to an item that is not on the agenda. And we have one speaker, and that's Blair Beekman. If we could take that speaker, please.
Sure. Blair Beekman, I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much. My words will take about 30 seconds. Thank you. I wanted to conclude here. I hope all of this, of what I described earlier, can be good steps out of the era of COVID-19 in the next few years into the future of positive sustainability, as these are simply the ideas and ways we were all dedicated to pre-COVID-19. To conclude, there was a helpful San Jose public meeting on housing today that may be of interest to yourselves. Thanks for this meeting tonight, and good luck in all of our work on this issue for the next few years, I guess. Thank you.
Our next speaker is Robert Aguirre. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Robert Aguirre again. Yeah, I would also like to add to what I had said before about okay, let me start again. So I think we at one point I made a suggestion that we have a court set up for unhoused people so that they can deal with their issues like trespassing tickets and things like that they're getting, that they're subject to get no matter where they are, they're trespassing. And it would be great to set something like that up so we could handle these cases much more humanely than just trying to throw them into traffic court or any of the other courts that we have and try to criminalize people for these things. I also would like to ask the council member from Campbell to look into the police, the Campbell City Police, because they are particularly cruel to the unhoused. They continue to sweep people and take things away from them, and they have a very bad attitude. I know I've had conversations with several of them, and they just continue harassing the people there. And I know there's a guy named Ron who works for the Public Works Department who goes and he takes things from people, doesn't have a real authority to do that. He just does it, comes along with a bulldozer and takes stuff from people and rides off into the sunset. And a lot of these things are taking our personal items. They don't get them back. Even though the police say that they've ordered them to be returned, they don't get returned. And it's a real strain on the people there. And so if you could look into that, it would be great. You can get a hold of me. Just about anybody has my contact information. And please let me know what's going to happen with that. If I need to go to the city council meeting, I would be happy to do that. I've done it before.
So to all of you, thank you very much for your service. And we really appreciate your thoughtfulness, your coming to these meetings ready, your ideas, and really giving us so many really important perspectives. So thank you. And when this goes to the board, we'll make sure that we shoot you all an email so that you know what item it is and what day it's going. All right? Be well, be safe, wear your masks, don't touch your face.
Thank you so much.
Be well, be safe.
Good night.
Bye.
Good night. Thank you.
Good night.
Thank you.
Thanks, everyone. Really, thank you for your service.
Thank
Very
you.
much appreciate it.
All right, thank you.
Thank you. Good night.
Good night.